Hi, hello. I'm Kavita. As Ollie has already said, I'm quite passionate about health and well-being and creating healthy spaces. And I think being in a healthy space should be a basic necessity, a basic human right without costing the earth. As people become more and more aware about the surrounding environment and the spaces they work in and live in, health and well-being is possibly going to be the next key trend for the next 30 years. It'll be the replacement of sustainability, which has been the key trend in the last 10 years. With the rising and aging population, this is putting health and well-being has become a focus because there's a lot of immense pressure being put on the NHS, and the driver here is to, what health and well-being is trying to do is to create a pathway where you can have prevention rather than cure in place. We must push government legislations and initiatives to improve the air quality of the spaces we work in and live in, as well as the outdoor air quality. We have to push for reduction of sugar, sodium, and fatty food intake in schools through school programs. We have to encourage employers to apply and create healthier spaces for the staff. This also drives staff to stay and live in London and retain staff in reducing absenteeism within working spaces. Health and well-being can be a driver where it will retain key people within London and also reduce skill gaps. What we are also starting to see and must see more of is creating healthier communities. What I mean by healthy communities is I would like to work with a developer where they're creating spaces with infrastructures where they're considering communities where people can socialize, affordable communities, where there's a health center for people to heal. There's a space, a well-placed park for people to go and rest. There are playgrounds for children to go and play. There's schools, habitat schools, where children can go and sit outside and learn, and also gardens or pocket habitats where you can plant your own food, with health and well-being at the center of decision-making before commercial interests. As we all know, social interaction can benefit physical and mental health. It boosts brain health and reduces loneliness and depression. We need more healthy communities such as these in our London. Lastly, all decisions we make now make little effect to us, but will have a big impact on our children and our future. I'm very passionate about this. Our kids will have to live the decisions we make now, so we must try to make some change. Thank you very much.